Posterity Health was founded and saw our first patient in March of 2021. And our founder had spent a lot of time in urology, but his passion was in male fertility. And he discovered during COVID that two things were happening. One, guys were more comfortable talking about their circumstances from the comfort of their home. And two, their spouse, partner, was more likely to attend or participate in the conversation, which typically had a positive effect, right, to dealing with the stigma of male fertility and getting the patient to take the right moves. So we started in March of 2021 and really began focused on working with fertility centers and working very complicated cases of male fertility, which then often would lead to medication management or sperm retrieval procedures to support IVF and the kind of couples fertility journey. When we founded the company, obviously we had limited resources, so we got a very cost-effective platform for doing telehealth visits. And it just wasn't something that was going to be scalable and reliable. And so we had to change the platform. What that low-cost solution did really well is it had both a referral management module or capability and the clinical medical record. But when we went to look at, the Epics, the Athenas, the modernizing medicines, they had really robust clinical platforms, but there was no way for us to replicate our referral management, right? So as an entity, we're very growth minded and we're very focused on speed and access as a competitive advantage or service level in our offering. And so we weren't going to be able to make the switch to the new platform if we didn't solve for the referral management side of it. So trying to think, Nick, I might get ahead of myself here, but so we looked at EMRs. Ultimately, we landed on Athena, and we needed a HIPAA-compliant CRM system, and we were expending a lot of human capital on sort of outreach, and so the marketing automation became a critical component. So when you looked for HIPAA-compliant CRM capability that could potentially work for both business to consumer and business to business applications, and you pulled marketing automation, there was just really two solutions. It was either LeadSquared or Salesforce.com. I said the consideration set got small quickly, right? HIPAA compliant, CRM, marketing automation, B2B and direct to consumer capability. So that brought the list down really quickly. So then, when you looked at LeadSquared versus Salesforce, one flat out cost, LeadSquared was probably 35-40% less expensive. Two was the consulting resources. LeadSquared had them in-house. Salesforce was directing us to third parties. Three is when you talked about implementation of capabilities and timelines, the speed to functionality, the speed to value seemed a lot faster with LeadSquared. So when we added really those three things up, it was easy for us to commit to LeadSquared. I mean, we were doing outreach before, but we were growing quickly, and when the volume spiked or the volume growth got ahead of the team, we would fail to do the outreach. We wouldn't do it consistently. So just the reliability of the automation, right? Once the lead gets in, they're getting emails, they're getting texts, people are getting prompted to do calls. We can track call performance, was really good. And then I think over time we've gotten, a little bit better and a little bit better in terms of how to communicate in that automation so that we could capture a broader set of people that were looking for a solution in this area, and we could nurture it over time. In simple terms, I'll say 7x. So we're doing 7 times the revenue that we were doing before LeadSquared, with the same number of people now, right? So there's some serious efficiency there. There's some other tools that we brought to bear in our technology platform behind LeadSquared. So maybe some of that's coming from, some enhanced onboarding capability and some Athena improvements as well, but let's just call it 7x. And then the other thing we've seen is a pretty consistent, 2-year-over-year improvement in our conversion capabilities. So if we were in, say, the fertility space, converting 55% of the referrals that were sent to us, we're now sitting in that 76 to 78% conversion rate. So, if you want to equate to incremental revenue, there it is. Take your lifetime value and add 20 percentage point improvement to it, and that's probably what it's worth, right? From my perspective, the LeadSquared team was fast, like us, committed, and had just very much a can-do mindset, right? So again, consultative in the approach. What are you guys trying to accomplish? Anil, who's been on our extended team, right, would be like, wow, we don't do that today. And then he would come back a few days later and say, okay, here's how we're going to do it, right? So just very resourceful, client-centric in the approach. There's obviously like data entry savings that occur, right, when you can move the data between the two groups. But for us, it's really about speed and about situational awareness about conversion. So, we set up automations, and a lot of the events, like a purchase in our e-commerce system or an appointment in Athena, would turn automations off and shift us to the next automation or launch the next automation, right? So being able to pull that data between the two systems seamlessly really drove effective and maybe I'd say higher functioning, more elegant automations in terms of that, which then drive improved conversion, improved patient experience. And then, the dashboards, right? The data, being able to see when the lead came in, when it converted, how many appointments it went, right? Lifetime value of the patient, that kind of stuff, again, very valuable and allowed us to, iteratively make improvements on our process and our messaging and things like that to improve conversion and get more efficient. So, earlier I said I was talking about the fertility channel and moving from a mid-50s conversion rate to a high 70s conversion rate. And we track that by channel. So we know direct to consumer, we know community providers, and other sectors that we're looking at, sort of how how we're performing in terms of conversion. We're marrying the data together, the Athena data together with the LeadSquared data, so that we know lifetime value, we know customer acquisition cost, we have an ROI calculation by service line, by internally we have regions, geographic regions, and we even, tear it down to the campaign level. So we might run a vasectomy campaign in Colorado, and we can compare the ROI of that to the vasectomy campaign in Texas, right? So yes, we're doing that. And we're making investment decisions and spending decisions based on that data. Well, I think if you're in healthcare, right, you should put LeadSquared and Salesforce head to head, see what they have. I think Salesforce is a very robust platform and they can do a lot, and they've done some amazing things in some very large healthcare organizations. I have a friend that implemented, Catholic Health Initiative solution, and they spent $300 million on it, right? So we're obviously not that organization. So I think if you're looking for value and speed, then you look at LeadSquared. And again, I'll say we looked at cost, we looked at time to functionality or time to value, and we looked at in-house versus outsourced, third-party consulting resources, and this was a logical choice for us, and here we are.